I'm Celeste Watkins-Hayes, and I'm the author of Remaking a Life: How Women Living with HIV/AIDS Confront Inequality. In 2005, I began interviewing women living with HIV. Women talked about the experience of what I call dying from, receiving their diagnosis and interpreting it as a death sentence. Over time, women discovered that they could live with HIV as a chronic, manageable illness. Women were dying from not just HIV/AIDS, but many were dying from a whole host of issues: past traumas, what I call the injuries of inequality, such as poverty and racism. So what they were really describing was an experience of dying from a whole multitude of challenges and moving along their trajectory of living with, figuring out how will they create new strategies to not only medically manage their HIV diagnosis, but socially navigate the stigma and socially confront many of the injuries of inequality that had previously hobbled them. So what dying from to living with to thriving despite is really illuminating is the ways in which the HIV community has not only helped people get access to the medications that will prolong their lives, but also helping people find ways to confront the stigma, to deal with the struggle and the shame, and to get to a place of stability as they confront many, many, many what I call injuries of inequality that they may be facing in addition to the actual HIV diagnosis.
Why has that dying from narrative, why has it gripped people? I mean, I think when people first hear it, that would be their first reaction.
Mm-hmm. It's a death sentence. I'm going to die. Yes.
Why has that narrative persisted?
Yes. Well, I think that when we think about the early years of the epidemic, that was often happening to people. And the HIV community very astutely understood that they had to change hearts and minds. The stigma was rampant. There were very few medications available. People were being discriminated against, thrown out of their homes, disowned by their families and communities. So there had to be a way to tell the story of people who were living with HIV and eventually dying of AIDS. So we saw a real rise in the pop culture references when we think about films like Philadelphia and the Normal Heart, Angels in America, the very important play. So there was in the public's mind this awareness of HIV/AIDS as a death sentence. And what we saw is this very interesting paradox as we began to develop more medications and the advancements in science developed. We had fewer people dying of HIV-related diseases and AIDS-related diseases, and we had more and more people living with. But the pop culture didn't necessarily follow it. And in some ways, the media didn't follow it. You saw fewer news stories highlighting what it means to live with HIV. So that first initial impression, the narrative and the vision that we have of a person wasting away in a hospital bed is still very much present in the general public's minds, but also in the minds of the women who get diagnosed. And what becomes critical is where can they find examples of what it means to live with, even if it's not in our movies, even if it's not in the media. Within their communities, they've got to find those reference points to understand that this is not, in fact, a death sentence.
If it weren't for HIV, I'd be dead. Typically, people think of it in the reverse. What did the woman who you interviewed mean by that, and why did you choose to start your book in that fashion?
Absolutely. Well, I thought it was such a powerful statement and a complicated statement. How can the an illness responsible for the deaths of millions around the world, helped to save a life. And what I came to learn from this woman named Dawn is what she was explaining was that the support system that was necessary for her to move from what I call dying from to living with to thriving despite HIV/AIDS was found within the HIV support community. So she was telling me about the significance of the social support network that constitutes our HIV/AIDS safety net and pointing to it as a life-saving resource that helps save her life.
What sort of safety net are you talking about there?
So it's a set of policies, the Ryan White Care Act, the AIDS Drug Assistance Program that provides medical care, medicines for people living with HIV, but also housing opportunities and other resources so that people can survive despite perhaps economic challenges that they're facing. But the HIV safety net was so much more. It was also about a community of people coming together, rooted in the early 1980s, that were committed to fighting against HIV/AIDS and the isms and phobias that were fueling the epidemic. So grounded very much in the GLBT movements of the early 1980s, but also really instrumental in helping us understand the HIV epidemic and the ways in which, in order to fight the illness, we also had to fight the inequalities that were driving it. The LGBTQ movement was really instrumental in helping to create a culture and a climate that would be very important for people to feel supported and connected to the HIV safety net.